This is the initial appointment of a patient who comes to me with gait problems, meaning walking disabilities, and all the typical symptoms of a Tourette's patient. She also has the symptoms of a TMJ patient. You can see in this video she is using a cane. She also described to me that she uses a walker also when her condition worsens. You can see the MRIs of her on the view box in the background. We never, ever initiate treatment without MRIs on these patients. This is the very next day. What we wish to accomplish on this is a diagnostic workup, which means a bunch of very sophisticated tomographic x-rays through the temporomandibular joints, impressions, and possibly her splint delivery. She comes with all kinds of head movements, hand movements, foot movements, and pain. Notice the uncontrolled movements of her hands, feet, and head.
She's holding her head up.
Okay.
Tell us what your symptoms are so we can record them.
I feel really tense all through here, and I can't stop twitching, and my eyes blink like crazy. And it shakes, like the back of my skull almost like shakes.
And how long has this been going on?
All the time.
Years?
Well, I didn't shake like this. I just didn't have until I started screwing around with my mouth TMJ stuff, but I didn't have any motion in my neck, and I would get horrible neck pain and stuckness, like torticollis thing, and migraines. Now those are getting better, but I twitch a lot. If I'm not somehow supported, so I like put pillows under my arms and under my head and stuff, but raising my mouth seems to help stop twitching. I still get twitching sometimes, but not like this bad when I have something in my mouth. I'm opening it wide.
Constant eye blinking and head twitching are cardinal signs of Tourettes Syndrome. Pain upon opening or limited opening of the mouth are cardinal signs of internal derangement of the temporomandibular joint. Many times these patients will present with symptoms of both Tourette's and TMJ internal derangement. I have had the patient using tongue blades in her mouth to determine what the vertical dimension is, so that I know at what vertical dimension to construct the lower splint. At this point in time, I am delivering the lower splint for the first time. Okay. Will I see you?
Yeah, there's one that there's a high fat right over here, but otherwise it should be much better, like the left and the right side seem.
You like it, huh?
Yeah. Sorry. In here, sometimes looks like it gets a little like.
As I take the appliance in and out of her mouth, adjusting it each time, notice that when I insert the appliance, her head and facial movements and blinking greatly diminish. And then when I take it out for the adjustment, they return. And then when I put it back in the next time, they greatly diminish. You breathing better? Okay. Let's see you get up and walk. You think you can walk?
So much crying. But I wasn't walking as much normal when I came in, just, you know.
Yeah, I didn't see it come in. Were you walking when you came in?
She was walking a little bit funny. Like this.
Okay, turn around and is that any better at all than when you came in or not?
I think it's a little bit better. I still feel like here, but I'm not. Well, it hurts just as much. I'm not quite as wobbly, I don't think.
Okay. Walk back over there. Many of these patients also suffer from low back or sacroiliac pain. This is due to sustained muscle contraction in this area. The patients invariably experience relief of these pains due to these appliances we make. We judge the effectiveness of the appliances by how they walk initially. Any improvement of the walk occurs in the first 2 or 3 minutes and then continues thereafter. And it gives us an idea of whether we're on the right track in the treatment of these patients. Believe it or not, this is an improvement in her walking. If you did not discern any noticeable difference, notice how her walking completely degenerates when I take the appliance out of her mouth. Not as good, is it?
I feel shakier.
Okay, I'm going to add to this. I have increased the vertical dimension 3 times, in fact, on this patient. You can seem to get out of the chair a lot easier. Okay, turn around. Okay, let's leave it like this for today, and this should improve. Practice walking backwards at home, you know, not particularly here. Do that like 5 or 10 or 20 times a day, you know, 10 feet across your living room or something. And people seem to adapt to it, improve quicker with practicing walking backwards.